Hi, Belén. Good afternoon.
Good afternoon, Miss. How are you?
Pretty fine. Everything okay. How are you?
I'm fine too.
Ready to travel to La Paz? It was for this week or the next one?
On Monday.
Oh, okay. So you have this weekend on Cochabamba.
Yes, Miss.
How was your day?
Oh, I'm really tired. I didn't sleep.
Why? Did you have a test?
Yes. Today was my last day of my practice.
Uh-huh.
So I have exam, but it was good.
Okay, so did you go well?
Yes.
So that you can sleep is not a bad thing then. You're
Mm,
gonna rest after this class. I promise I will finish on time. But where are your classmates? Let's wait just a few minutes, okay?
Okay, Miss.
Do you have any questions for... Oh, we have some homework with you. I think I was forgetting.
About yesterday, it was the meanings, the synonyms.
The synonyms. We couldn't speak about that, right?
Yes, it was of cicatrization and healing.
Okay. Who's there? Oh, Ale. Hi,
Hi,
Ale. Good afternoon.
hi Belén.
Hi, Ale.
Okay, so I think we can start. I hope your classmates can make it. Okay, so we're gonna continue, but first, or we're gonna leave the meanings that Belén look for us and that she will share with us at the last part of the class, okay? I don't know if you can watch my screen.
Yes, Miss.
Okay. Can you help me reading this, Ale, please?
Yes, Miss. Shortness or of breath or breathlessness is dyspnea.
Disney.
Dyspnea. At first, this is caused by exertion. Physical activities such as climbing stairs, but in several cases, it may present even at rest. A patient who is breathless when lying flat, orthopnea, for example, in bed, will tend to sleep they set up on two or more pillows. The abbreviation SOBOE stands for shortness of breath or exercise on exertion or on effort. Patients say, I get terribly short of breath climbing stairs. Doctor can ask, how many pillows do you sleep on?
Okay, thank you, Ali. So we have new words here, right? I know you can understand shortness of breath or breathlessness or dyspnea. I'm sorry, I ate a letter. Who is there? Lily. Okay.
Hi,
So,
teacher.
hi, Lily. How are you?
Excuse me.
Don't worry. We're just starting now. We are talking about circulation. okay? And these new words that we are gonna use, exertion. Do you understand the meaning of exertion? That is a physical activity such as climbing stairs. But the main word, do you understand
Yes.
what it might be?
Esfuerzo.
Yes.
Esfuerzo.
Okay. Thank you. That's so good. You understood everything. Okay, so patients say when they are getting into your consultation, I get terribly short of breath climbing stairs. And doctors can ask, how many pillows do you sleep on? Or another questions that you're gonna do in these cases. I don't know if you have any idea of some other questions that you can use when patients go saying that they cannot breathe well.
When
Times, right? Oh,
it's
sorry.
like when they walk, how many, I don't know how to say cuadras.
Blocks.
How many blocks can they walk without getting tired, or how many stairs, and that.
Okay. Okay, that's good. It's another way, right? To find out what would be the situation or the condition of these patients. Especially this time that we are suffering with COVID, right? Maybe there are so many patients that will go to your consultation saying, I cannot breathe, but I don't know, maybe most of them hypochondriac, right? Or maybe they are passing COVID. What do you say, guys? Lily, do you have that experience?
Patients with COVID, I referred short of breath, um, and many opportunities. I have administrate oxygen.
Okay. Okay, that's good. Administrate and oxygen. Okay.
Oxygen.
Okay. Belen, can you read this part, please? And Lily will read the box.
Okay. Heart rhythm.
Okay.
The normal resting heart rate is 65 to 75 beats per minute. In athletes, it may be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 200 minutes. The heart rhythm may be regular or irregular. In an irregular rhythm or arrhythmia, there may be early beats which interrupt the regular rhythm, premature beats, or the rhythm may vary with respiration, or it may be completely irregular, as in fibrillation. When patients are aware of irregularity, they describe the symptoms as palpitations.
Okay.
Case 4. A 22-year-old student was admitted to hospital with a long history of heart problems. She had been increasingly tired, with shortness of breath, of exertion, orthopnea, and palpitations. A mitral valve replacement had been carried out year previously, and this had stabilized the symptoms of heart failure, but was followed by episodes, attacks of atrial fibrillation, which had been particularly severe for the 6 months before admissions.
Okay, thank you very much. So we have the heart rhythm, right? I don't know if you have any questions here for vocabulary in the first part.
No, teacher.
Everything is understood, right? Everything is remembered, I think. Okay, and in this part, watching the case 4 is giving us a brief story, right? A 22-year-old student was admitted to hospital with a long history of heart problems. She had been increasingly tired with shortness of breath on insertion, orthopnea, and palpitations. A mitral valve replacement had been carried out 3 years previously, and this had stabilized the symptoms of heart failure, but was followed by episodes or attacks. Okay, in this case, episodes is referring to attacks of atrial fibrillation, which had been particularly severe for the 6 months before admission. And here, you have any questions for vocabulary?
No, miss.
No, teacher.
Then we have the heart failure. Once again, Ale, can you read this part, please?
Yes. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output. The amount of blood pumped by the heart each minute for the body's needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptom is breathlessness. The symptoms of right heart failure include peripheral edema,
Huh?
swelling, beginning in the feet and ankles. This is known as pitting edema if, when a finger is pushed into swelling, it causes a small depression or pit.
Thank you, Ale. Okay, so here we have a little new words. Like, for example, heat. Do you understand that meaning? Since we know that it could be depression or pit.
It could be like a hole.
Yeah. Yeah, that's good. You have to find a way to understand these kind of words or synonyms, right? And it's almost the same. It could be a hole or depression. What another word you cannot understand or is new for you?
Pitting edema.
Where is it? I cannot.
Pitting.
Pitting edema. Yeah, here, right?
Yes.
The symptoms of right heart failure include peripheral edema or swelling, right? Beginning in the feet and ankles. This is known as pitting edema. If when a finger is pushed into swelling, it causes a small depression or pit. So it might be edema with a depression, pitting. Okay, you have another way to explain this? Maybe Belen?
Could be like when we have edema, the pitting edema, it will be the moment or the action of making us as a doctors the depression or the pit in the edema, so we can see the hole on it.
Yeah, I understand the same. Pitted in edema is like a depression there, right? Maybe in the moment where you are making a procedure, I don't know. Do you understand, Lily?
Yes, en español es como edema con fobia positiva, pues la fobia, lo que uno le
Okay,
llama.
okay, that's good. So that will make us notice that it has a specific name, okay? Can you repeat the name, please?
Fobia. Ya.
Edema con fobia, right?
Exacto.
Okay, thank you, Lily. Then, another word that we can look for. Do you understand this word, in this case, output? It refers to a production. Do you have any questions here? I will ask you, please, guys, that can close your microphones. Please. Just make it work for sharing your opinions with us, please. Okay. So it's understood? Lily, Ale?
Yes, Miss.
Yes, teacher.
Yes, Miss.
Okay, perfect. Let's continue then. Okay, we have a game here. And since we know the definitions of these words, we're gonna find the meaning. Okay, so maybe who's gonna start? I don't know. A volunteer, please. Lily?
Orthopnea,
Okay.
a patient who is breathless when lying flat.
Okay. Oh, sorry. It was so bad. My game. The next one, we will see it at the end.
Arrhythmia in a unicellular synth.
Okay, Ale, thank you. Belen?
The first one was dysphonia or orthopnea.
Dyspnea.
Dyspnea?
Yeah.
Oh, okay, dyspnea. Okay. Orthopnea, it's a patient who is breathless when lying flat, I think.
Okay, that's good. But that was the one that says, Lily, you have edema or dyspnea. Can you?
Ah, okay. Edema is swelling.
Okay, so let's find out. Okay, so my game wasn't so good enough. But dyspnea, shortness of breath, breathlessness, right? Arrhythmia in an irregular rhythm. Orthopnea, a patient who is breathless when lying flat. And edema, swelling. So that was good. Then we have the part 2 of circulation and heart. Lily, can you read this part, please, for examination?
Physical examinations. Medical examination is normally carried out in 4 stages: inspection, looking, palpation, feeling with the hands, percussion, tapping with a finger, and auscultation, listening with a stethoscope. Note, the verb is palpitate. The noun is palpation, not palpitation.
Okay, thank you. That's good to remember. So when you're doing a medical examination, it's normally carried out in 4 stages, okay? Inspection or looking, palpation, not palpitation, palpation, that means feeling with the hands, percussion, tapping with a finger, and auscultation, that is listening with an stethoscope, right? So I don't know if I know this is for an specialization, right? But I think that you usually use this at your consultations, or you learn how to do it, right?
Right.
Right, teacher.
Okay, so is there missing something, or you are agree with this procedure?
Agree, miss.
Agree, teacher.
Perfect. If you want to add something, thank you, Ali. If you want to add something in every single way, sharing with us your experience, it's okay for me, okay?
Okay, teacher.
Then we have, I'm so sorry. There are a lot of cars and motorcycles here. I will ask you to close your microphone, please. And just when you wanna share your opinion, you can open, okay? Thank you. Okay, examining the heart and circulation. Look at the lips, tongue, and nails for the blue discoloration of cyanosis. Cyanosis may be central or peripheral. Inspect the hands for clubbing. Feel the radial pulse at the wrist and note the rate, for example, 70 over a minute. And rhythm, regular or irregular, okay? We are describing more or less the procedure of examination, right? And I don't know, Ale, can you read this part, please?
Sure. The pulse may be irregular in force as well as time. Check that the other peripheral pulses are present. Measure,
Continue.
Measure the blood pressure and assess the jugular venous pressure, GVP. Palpate the chest for the apex beat. The normal position is the fifth left intercostal space on centimeter medial to the mid-clavicular line. Feel for any trills. Heart size may be measured by percussion. Listen for murmurs and other abnormal sounds. For example, I don't know.
Fraction rubs.
Fraction rubs.
Yeah, I'm sorry. I ate the words. Okay, thank you, Ale. Belen, can you read this part, please?
Okay. Beginning at the mitral area, murmurs may be soft or loud. A harsh murmur is loud and raw. Note the time of any murmur in relation to the cardiac cycle. The most common murmurs are mid-systolic, in the middle of the systole, pan-systolic, lasting for the whole of systole, early diastolic, mid-diastolic, late diastolic, pre-systolic. Continue by listening at the tricuspid, aortic, and pulmonary areas.
Okay, thank you very much. So I know we have to find these new words like inspect the hands for clubbing. Okay, clubbing means a deformity of the finger or toenails associated with a disease. Okay, that is a clubbing. Hi, Vania.
Hello, Miss. Good afternoon.
Oh, good afternoon. Okay, we'll continue. So do you understand the meaning of clubbing, right? Or do you want me to repeat?
Yeah.
I will repeat it then. It's a deformity of the finger or toenails associated with a disease. Okay, so what other word do you want me to tell you the meaning? Maybe measure the blood pressure. Do you know the meaning? Someone can explain? Okay, I will do it then. Measure will determine the extent or quantity of a substance, in this case, blood, okay? Then we have the word harsh. Do you know the meaning of harsh?
No, Miss.
It will be like a hard or tough murmur in this case. Harsh, tough, or hard murmur, okay? Do you understand now?
Yes.
Very good. Vania, I don't know if you have any questions here of vocabulary.
Yes, Miss. I don't understand. Harsh.
Harsh.
Yes, Miss.
Okay. Harsh, it's like, we're going to find a synonym for this. Could be hard or tough. Okay. In Spanish, like duro, fuerte. Okay.
Okay, Miss.
Okay. And murmur, do you understand the word? It might be like soplos. Or do you have another word to explain this?
No, I think it's the same.
Okay, or might be of course, the sound that you heard with your stethoscope when you are making the I forgot the word, the auscultation. It might be murmur, right? And when you find a harsh murmur, means that it's so tough or so hard. That is a murmur. It's un soplo. Okay? Is it understood now?
Yes, Miss.
Okay. Another word, or we are good here?
Miss, what is ACES?
Where is it, please?
Measure the blood pressure and ACES. ACES.
This is the jugular venous pressure. It's like an evaluation. Evaluar.
Thanks, Miss.
No problem. Okay, so we're good here.
No, teacher.
No, you didn't understand, Lily? There is something you want me to explain?
Yes, teacher, I understand.
Oh, okay. Okay, what about you, Belen, Ale?
It's fine, Miss.
Okay, Vania,
Okay.
are you okay with?
Yes, Miss.
Perfect. Okay, then we're gonna introduce to another topic, infections. Okay, Vania, can you read this part for me, please? Just this box. I will read the other one.
Case 45. A 24 years old man present with a fever which he had had for 3 days. On the third day, he had had a severe attack of fever with sweating and rigors. The only past history of relevance was hepatitis 4 years earlier and glandular fever.
Fever.
Infection with Epstein-Barr virus at the age of 18 years. He had returned from Africa 3 weeks previously.
Okay, thank you very much. Then we have here some a person with an infection, right? And in this box, we are reading that is describing some symptoms and signs that are presented. So we have fever and means pyrexia, okay? That is also, remember, like PUO, pyrexia of unknown origin. I don't know if you have this in Spanish, or you know the word in Spanish, the specific word. If you know it, please share with us. Then we have fever, also known as temperature, okay? the got a temperature. I've got temperature. Okay, that's an example. And the adjectives, feverish or febrile, and pyrexia. The opposites, afebrile and apyrexia, right? I think it's almost the same in Spanish. Afebril, is it right?
Yes, it's right.
Yes, teacher.
Okay, perfect. Then some symptoms of fever, like sweating. Do you understand this word, sweating?
Yes.
Belén,
Yes, teacher.
okay. Ale, do you understand this word?
Yes, Miss.
Perfect. And Vania?
No, miss.
Okay, sweating. Belén, can you explain to us this word, please?
In English,
In English, please.
I will give an example.
Okay.
It's like when you're running a lot of time and you start to sweat. You're having a how can
A
I
lot of
explain?
word
Yeah, a lot of
getting
work.
out of your body, right?
Yes, yes, and your shirt is really. How can I say it? I don't know. In English, it's really hard.
Yeah, I know, but we have to find the way. I don't know, Vania, if you get an idea, more or less.
Sí, no.
No, not so good, I think.
No.
Okay, another example. Lily, can you give us another example?
When the weather is very hot, then the people starting to sweat.
To sweat.
Mm,
Okay, and then again, water goes out from our body, right?
Now, yes.
Okay, that's good. Can you tell us in Spanish? Vania?
La transpiración.
Yeah, that's good. Sudar, right?
O diaforesis también lo decimos nosotros.
Okay, it's better if you use those words in English. But in Spanish, sweat, it's like sudar, okay? But it's so good. Perfect. And we have the rigors that are severe shivering and sensation of coldness, also known as chills. Do you know when you feel so cold and you start to move with no reason and involuntary? That is shivering. Do you understand?
Yes.
Okay. You have another way to explain this, or it's understood? Because in Spanish, it's almost the same. It's the same word, rigor, right? I don't know if someone want to share with us, or is everything understood? Ale, do you understand this word?
Miss, rigors, it could be escalofríos.
Yeah, I think it could be not a synonym, but almost the same meaning, because we find here by definition that it's a severe shivering, right? And sensation of coldness, also known as chills. I know that we have the word in Spanish with the same name, rigor or rigor. And do you know the meaning of rigor? I think it's when someone is rigid, right?
It's when people is dead.
Is dead, right? But it's it's the word in Spanish is rigor. Is when someone is rigid, is dead. They have no shivering and sensation of coldness, right? Then we have the word that Alice says that was, what was the word, Ale?
Escalofríos.
Calofrios. That it will be almost the same, okay? But is it understood this?
Yes, Miss.
Okay, Vania, Lily, Belen.
Yes, teacher.
Yes, Miss.
Okay, perfect. Then we're gonna go to microorganisms. And Lily, can you read this, please, for us?
Microorganisms. Infections differ from other diseases in a number of aspects. Most importantly, they are caused by living microorganisms such as viruses or bacteria that can usually be identified, thus establishing the etiology early in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable. Unlike many not-infections, degenerative and chronic disease, communicability it's another factor which differentiates infections from not-infection disease. Transmissions of pathogenic organisms to other people directly or indirectly may lead to an outbreak or epidemic. Finally, many infections are preventable by hygienic measures by vaccines, especially lip attenuate vaccines such as rubella vaccines, or by drug prophylaxis, for example, chloroquine to prevent malaria.
Okay, thank you. So here, do you understand the main idea? Do you have any questions for vocabulary here? For example, outbreak. Here, transmissions of pathogenic organisms to other people, directly or indirectly, may lead to an outbreak or epidemic. Do you understand the word? We're gonna pass an outbreak just a month ago, right? After I don't know, an outbreak on 2020. This is the second outbreak here, for example, in Bolivia. Do you understand the word?
Yes, Miss.
Yes, teacher.
Ale, do you understand, or Vania?
Yes, Miss.
Vania, do you get the idea?
Yeah, yes, Miss.
Okay, someone can tell me in Spanish what does it mean, please?
El rebrote.
Yeah, it's a broad. Okay. Okay, I don't know if you have any other questions of vocabulary here.
No, miss.
Okay. Can we continue then?
Yes, teacher.
How about Ale and Vania?
Yes, miss. It's okay.
It's okay, miss.
Okay. Then microorganisms include bacteria, viruses, fungi, protozoa, such as the parasite that causes malaria. Another general word for these pathogens is microbes. Patients, I'm sorry for the back sound. I'm so sorry for the back sound. Okay, patients often refer to microbes or as germs or bugs. Notice the common expressions for acquiring an infectious disease. Could he have caught some disease from the dog? Or could he have picked up some disease from the dog? And someone may answer, I think I caught the flu bug that's going around. This is just an example. I don't know if some people go to your consultations saying that they had they've been contagious by a bug or something like that. Do you have any experience like that? I don't know, maybe Lily on emergency.
Yes, teacher. The patients referred they picked out the the germs or the bugs.
Okay, here we have some, I don't know, maybe the bugs or even though the kari, right? Some diseases here are called with some common names in Bolivia. I don't know if you heard about this, Belen.
The one that you say, no, miss. I just know dengue and Zika Zika and
Oh, could no, another one. I don't know. I don't know if could be a bug or something that get into their heads.
about trichina.
I no, in the superficial epidermis, but in their heads, not even in their skin, in their heads. I will find out and I will tell you more about this, okay? But I heard about this in my rural year. That's why I'm sharing with you. And I was hoping that you have more or less the same histories like me. But people go to the consultation, especially in that areas, saying that maybe some bug or something. They don't use the words microorganisms, right? I don't know if you have any questions here for vocabulary.
No, miss.
No, miss.
No, teacher.
Oh,
No, no, miss.
okay. And we have this box. Can you read it, please, Belen?
Source and spread of infection. An infection may originate from the patient endogenous, usually from skin, nasopharynx, or bowel, or from outside sources, exogenous. Often another person who may be either suffering from an infection or carrying a pathogenic microorganism. Caries are usually healthy and may harbor the organism in the throat. For example, diphtheria, bowel salmonella, or blood, hepatitis B or HIV. Non-human sources of infection include water, cholera, milk, tuberculosis, food, botulism, animals, rabies, birds, psittacosis, and also the soil, legionella, or legionella, I don't know how to say it in English. It's how can I say it, miss?
It's okay, Legionella.
Okay, Legionnaires' disease. The incubation period is the period between the invasion of the tissues by pathogens and the appearance of clinical features of infection. The period of ineffectivity is the time that the patient is infectious to others.
Okay, perfect. Do you have any questions of vocabulary here or something that is not understood?
Miss, I don't understand. And also the soil.
In which part, please?
In the second paragraph and in the last part. No, in the first paragraph, in the last part. Before parentheses, yes.
Oh, here. And also the soil. Where is it? Non-human sources of infection include water, cholera, milk, tuberculosis, food, botulism, animals, rabies, birds, psittacosis, and also the soil, legionella. Okay, we're gonna find out what does it mean. Soil. It might be some cause. It's like earth. Okay, it's tierra. And it might be the cause of this disease, or where you're gonna find this microorganism. Any other question?
Teacher, in the third line, the word harbored.
Okay, carriers are usually healthy, right? And may harbor the organism in the throat. It might be used like, because harbor is, the meaning of harbor is puerto, right? But in this context, it can be used as el lugar donde los organismos se van a encontrar, o el puerto de entrada. Okay?
Okay. Thanks, teacher.
No problem. Any other question? I think it's pretty much understood, right?
Yes, Miss.
Yes, teacher.
Yes, Miss.
Okay. And we have the mental illness. Here, can you read it, please, Vania? This paragraph, the first.
Psychiatric disorders. Psychiatric disorders can be divided into organic and functional. Dementia is a mental disorder due to organic brain disease. The commonest form of dementia is that associated with old age, senile dementia, disorder in which there is no obvious pathology or anatomical change in an organ are termed functional.
Okay, thank you, Vania. Then we have substance abuse. Can you read it, Ale, please?
Sure. Substance abuse. Abuse of substance means using it in a way that harmful. The commonest forms of substance abuse are alcoholism and drug abuse.
Thank you. And then, Lily, can you read the neurotic and stress-related disorders?
Neurotic and stress-related disorders. An example of neurotic disorder is obsessive compulsive disorder. An obsession in an idea that is so persistent that it interferes with the patient's life. A compulsion is an obsessive idea that forces the patient to act even though they recognize that is unnecessary. A common form of this is compulsive washing of the hands. Stress is a feeling of being unable to cope. It can lead to anxiety or fear or problems. A sudden attack of anxiety is called a panic attack.
Thank you. Thank you very much. So here we have I don't know, maybe some new words for you to understand. I will explain terms, okay? That it's like a common name used like functional. In Spanish, it might be like or anatomical change in an organ that are called or llamado funcional. Okay? What else? Do you have any questions for vocabulary here?
No, Miss.
Okay, but I have a question for you. Maybe in your, while you are making the anamnesia, you ask some kind of questions to know how is the mental, if the patient has a mental illness, right? Or am I wrong? or is the most deepest way to an examination in this case?
Well, we learned to make a mental exam, but I never seen a doctor apply that.
Okay, me neither. What about you, Vania and Ale, Lily?
There are many medical tests. It's a fast test. You can apply in your patients. You can questions about some topics. You can they should write her names or drive some picture and
Okay.
it's a basic test.
Okay, it's a basic test that you use.
Hash.
And you apply it? Did you do it some time, or just when you see that maybe one patient must need it? It's not for all?
In some patients, because if they have backgrounds of mental illness, is más directionate the questions. Yes.
Okay, I get it.
When we elaborate the medical story in the neurologic part, we have some questions and the general question, and if the patient doesn't answer correct, like we say, nosotros ampliamos y vamos al otro examen, complementamos, pero
okay. Complementary tests. Is that what you want to say, right? Or complementary questions? Okay, so this I saw in some history that can be used like little questions that are not frequent, right? Like in which year we are, I don't know, just to know if the patient is conscious about the day or the date, right? Or am I wrong? Hello?
No, that's correct. In the neurologic, some basic questions.
Okay. Okay, this is a subject a little bit long. Okay, but we're gonna just fill the questionnaire and we're gonna talk about the other slides next week. Please fill it for me. Thank you very much, and I hope you have a great weekend, okay? And see you Monday, on Monday. I will share with you some homework, okay? Just to, but it's so easy. You have to practice just for that. Okay, guys? See you Monday. No, I'm sorry, Tuesday. I'm so sorry.
Thank you, Miss. Bye,
Thank
everyone.
you. Bye.
Bye.
Take